Assalamu alaikum. My name is Dr. Ijaz Ahmed Khan. I'm a professor of pediatrics and infectious disease at Shifa International Hospital. I'm also the chairman of infection control at Shifa International Hospital for the last many years. Today we will going to talk about transmission-based precautions, and the learning objectives for today's talk is that by the end of this session, the participants should be able to identify the different categories of transmission-based precautions, decide how and when to do transmission-based precautions within available resources based on disease transmission, identify the duration of isolation precautions required for common infections. We're going to talk about CDC standards, and we are going to talk about antimicrobial stewardship and the role of reduction in MDROs or multi-drug resistant organisms as well. So why infection control? You know that hospital-acquired infections are a common problem. About close to 10% of all infections are hospital-acquired within the hospital settings, and we know the hospital-acquired infections can have devastating effects in terms of poor outcome, antimicrobial resistance, and high cost. Primarily, the reason is poor infection control practices, which by spreading the infections, and also antimicrobial overuse, which leads to development of antimicrobial resistance. Hospital-acquired infections increase the cost of healthcare, and it is estimated that about 50% of total healthcare budget in hospitals is because of hospital-acquired infections. So effective infection control programs are beneficial. They decrease the spread of nosocomial infection, morbidity, mortality, and healthcare costs. So standard and transmission-based precautions is a must for control because they are efficient, number one, and also they are cost-effective, they are cheap and easily to do as well. So what is a transmission-based precautions definition? So when there is a strong evidence for person-to-person transmission via droplet, contact, or airborne routes in healthcare or non-healthcare settings, and the patient factors which increase the transmission risk. The assignments of patients reflect the predominant mode of transmission, and standard precautions are assigned if there is a low risk or no evidence of person-to-person transmission of droplet, contact, or airborne routes, which we are going to talk in detail. Standard precautions are assigned for bloodborne pathogens, hepatitis C, HIV, and also the evidence has confirmed for efficacy of standard precautions to prevent exposure to infected blood or body fluid. Just to highlight the key points of isolation, to begin with, basic standard precautions are a must for all patients, but additional precautions are mandatory for specific indications we are going to talk in detail. Preferably, patients should be in single rooms, or they can be a cohort isolation as well. And of course, empiric isolation are practiced according to the signs and symptoms, or what we call syndromic empiric precautions. You do not wait for laboratory tests to isolate patients. The other thing important is the consent from patients, and what we mean by that is that patient must understand, and also their attendant must understand why precautions are taken. The family has to understand why is it important, because number one, it can be spread to them and also to other environment in the hospital and other people, visitors, and also healthcare workers. Equipment and services are responsible for a lot of transmission infections. So we should ensure that there is minimal stock inside the patient room. The patient should have dedicated blood pressure stethoscope. We must ensure that the environment, especially the equipment and surfaces, are clean, preferably daily or a couple of times a day depending on the situation, and of course disinfection after thorough cleaning, validated methods as well. For staff, there should be minimal staff inside a patient's room. We should practice hand hygiene at all times. Immunization for the healthcare is important in terms of, for example, if they are exposed to these infectious agents, they are at risk. These include hepatitis B, influenza, other infections as well. Use of personal protective equipment must be given as well. Cough etiquettes are important for everyone, including the staff. In a hospital setting, in a large hospital setting in which there are a lot of activity going on, it is important that for isolation practices or infection control practices, there should be good communication of the units or staff with the infection control team on a daily basis almost, because you need to notify the patients who are suspected, confirmed for any infection. whether they are in the clinic or in the inpatient setting. These include other MDROs such as MRSA, VRE, and they should be, of course, identified by placing a sticker on their chart or outside their room. So what does this is a CDC standard, that general principles that in addition to standard precaution, use transmission-based precautions for patients with documented or suspected infection or colonization with highly transmissible or epidemiologically important pathogens for additional precautions which we're going to talk about. The extended duration of transmission-based precautions, droplet on contact for immunocompromised patients with viral infection due to prolonged shedding of viral agents which may be transmitted to others. So there is category 1A in terms of evidence for that. So what are the major isolation categories? These are the three main categories. Airborne, for those diseases known to be transmitted by the airborne route. These are through the small airway dust particles which are less than 5 microns or smaller, and examples include tuberculosis, varicella or chickenpox, and measles. Droplet precautions are diseases that are known to be transmitted by respiratory droplets, require large particle droplet greater than 5 microns, and these are usually in those patients in which you are close within a certain distance, less than 5 feet or 3 feet. These include invasive meningococcal disease, pertussis, influenza, etc. Contact precaution, on the other hand, are those diseases known to be transmitted by direct contact or indirect by contaminated object. These include C. difficile infection, VRE, MRSA, MDROs, and XDROs. To talk about individual transmission break precaution, first is airborne. These are most difficult as it requires special control of air infected source. These precautions are especially important for the staff and visitors entering the room. Hand washing is a must with alcohol or soap and water before entering the room and after coming out of the room. Negative pressure room, making sure that there is a HEPA filter in the room. Make sure that the door is closed, and to wear N95 mask when you enter the room as well. An example is chickenpox, a patient who has been isolated in a single room, preferably those with vaccination or had chickenpox in the past should take care of such patients. Hand washing is again important. Patient should be in a negative pressure room. Ensure that the negative pressure mechanism is on, especially like HEPA filter is on and they are working, and to keep the door closed. So respirators that we use, N95, they should be fit tested initially, then annually with employees, because you need to make sure that your N95 mask is working properly, and how to use it as well when you have a patient with highly transmissible airborne infection. Airborne isolation rooms, just a few points I want to build here, that the hospital should have special rooms which have special ventilation, in which the movement of air in the building and the replacement of air inside the air from outside is handled. And these include natural ventilation and mechanical ventilation. Natural ventilation means that in which the doors and windows are open to bring in air from outside, because it will distribute the air inside, it will dilute the air concentration in the particles, and of course direct sunlight also kills bacteria, and because they can survive in the dark for several hours. And healthcare workers should preferably be near the air fresh source to minimize their risk. And of course they can be useful for non-traditional settings that do not have a central ventilation system. This is an example of airborne infection isolation rooms, and you can see that there is a TB patient and there is a negative pressure created in which compared to the corridor, and there is about 12 air exchanges per hour. The air supply system is in place. There is a private bathroom inside as well. There is a window in which you can use as well, and there is an exhaust to the outside environment. So this is an example of isolation room. You can see that the door is closed. This is dedicated stethoscope, blood pressure machine. There is a PPEs present, including gloves, gown, hand washing technique, and there is a sticker in red which says contact isolation. For airborne precautions, there is a negative pressure room with isolation and PPEs outside the room as well. For negative pressure room, preferably you can use what we call a digital thermohygrometer, in which there is you have constant measurement of the negative pressure room, and you can keep a monitoring sheet almost on a daily basis, in which you check whether there is a negative pressure room. For example, this sheet, if you can read it, says -5, -15 or something like that as well on a daily basis, or preferably in each shift. And these are checked by people, especially when the patient is in that room on a monthly basis. For airborne precautions, just to be in detail, when to discontinue airborne transmitted infections. For tuberculosis, these are common infections. Of course, there is a whole list which you can look up. I will show you as well that TB, you discontinue precautions only when the patient has effective therapy, is improving clinically, and has at least 3 consecutive sputum smears negative for acid-fast bacilli collected on separate days. Usually the duration of ATT in which and a patient is considered non-infectious is more than 2 weeks, but up to 4 weeks can be as well. For chickenpox or varicella zoster, the duration is until the lesions are dry or crusted, which usually is about 7 days or more. For measles, it is usually 4 days after onset of rash, but for immunocompromised, it is for the duration of the illness, which can be up to 2 weeks. Coming to droplet precautions, which are the other common mode of transmission based, in which the patients is preferred in a single room. You prioritize patients. You can do cohort patients as well. Separate patients who are immunocompromised is recommended, and of course for those patients who are on cohort, about more than 3 meters should be separated between the beds. There should be a curtain subsection to ensure that there is no minimize cross transmission. For droplet, again, hand washing is the number one method to ensure that you do not transmit these infections, and the patient should be within 1 meter of the other patient. Surgical mask should be worn, especially when you're taking care close to a patient as well. Eye protection for close contact, and also when you're doing any procedures. You use gloves as well, and to wear gown to enter the rooms or bed space. Examples, these are examples and the duration of precautions. Influenza and most of respiratory infections are droplet precautions. Influenza is just one example, and for influenza particularly, it is usually the duration of precautions is 5 days after onset of illness, because then the viral load immediately decreases. For Neisseria meningitidis, droplet precautions is for the first 24 hours after antimicrobial therapy, which means if the patient is admitted at 12 o'clock today, then the droplet precautions can be discontinued after 24 hours if the effective antimicrobial therapy was started 24 hours ago. For mumps, it is 9 days after onset of swelling, and there are other examples as well. For contact precautions, you should be again doing hand hygiene, wear gown to enter the room as well, and to wear 1 pair of gloves. Contact precaution, remember, is one of the commonest mode of transmission based precautions, and again the patient should be preferably in a single room, or if there is cohorting of similar organism, then the patient should be spaced about 1 meter from each other. And of course, when you're taking care of the patients for doing a procedure, then mask is also recommended. This is again a CDC snapshot of contact precautions. Again, you should highlight such patients outside patient's room, that everyone should be again using their hand hygiene before entering and when leaving the room, gloves, gown, and dedicated equipment for the patient. and of course environmental cleaning as well. Examples of contact precautions include MRSA for all staff entering the room, washing hands, wearing surgical mask for MRSA, wearing gown, and of course wearing one pair of gloves. For VRE, vancomycin resistant enterococcus, additional methods that have been recommended, because VRE is a difficult organism and it is easily transmitted, is that to wear 2 pair of gloves and of course use dedicated cleaning equipment and to clean the room or what we call terminal cleaning twice daily. Now coming to contact precautions recommendation for discontinuing isolation of contact transmission infections. Examples, draining wound. Let's say there is an abscess or there is a certain multi-drug resistant organism, then usually it is for a duration of illness in which there is no dressing or containment of drainage is done, and until the drainage stops or can be contained by dressing. C. difficile infection, for a duration of illness, use of soap and water for hand hygiene, which we are going to talk about. C. diff is different, in which sanitizer is not recommended, but soap and water is recommended for hand hygiene. For multi-drug or resistant organism, in which is the commonest and of course found in large hospitals and small hospitals and even in the communities. For the discontinuation of isolation, there is no specific recommendation for when isolation can be discontinued, but it has been recommended that it is reasonable to discontinue contact precautions when there are 3 or more surveillance cultures for that organism are negative over the course of a week or 2, especially in the absence of draining wound. But in a hospital settings, it is recommended for the duration of hospitalization and sometimes even as long as 3 months as well. Now this slide shows you what happened in COVID. That COVID did a lot of good things for isolation purposes, in which a lot of equipment came, people started using PPE more religiously, and of course we have better habits now in terms of hand hygiene as well. So this is just an example to give you about how as a healthcare worker we must create awareness. This is just a leaflet about information about healthcare workers on COVID-19. This is about how, what, when, why and where to do isolation purposes depending on the healthcare workers, laboratory staff, housekeeping staff, visitors. This was just an example. This is for PPE. We made some videos as well for donning of PPEs, for contact and precautions, and also droplet precautions and what to do, and this was disseminated to the staff and as well as to the general public. Coming back to empiric syndromic use of transmission based precautions, every effort should be made to diagnose the microorganism responsible for infection, but implement transmission based precautions based on the patient's signs and symptoms until a definitive diagnosis is made, whether you use a laboratory test, whether it's a stool test, whether it's a respiratory specimen or not. This is an example of contact droplet airborne syndromic precautions in which you empirically start when the patient is admitted to the hospital. For contact precaution, examples include diarrhea, patients with whether children or adults, C. diff, upper respiratory tract infections, history of infection or colonization, abscess drainage, skin or wound infection, surgical wound infections with multi-drug resistant organism. For droplet infections, patients with upper respiratory tract infections such as cough, runny nose, sore throat, congestion, severe persistent cough in which you can suspect pertussis, meningitis, hemorrhagic rash and generalized rash as well. For airborne, there can be chronic symptoms such as cough, fever, weight loss in which you suspect TB, rashes such as pustules suggestive of varicella, acute respiratory distress syndrome, for example, risk in the community in which there is, for example, COVID is a good example, vesicular rash, for example, varicella as well. This is some more examples of syndromic diseases. Diarrhea, patients with diarrhea, potential pathogens you can suspect, enteric pathogens, C. diff, and what types of empiric precautions are recommended. For example, contact, droplet, etc. For patients with meningitis. Similarly, what to suspect those patients with rash, what to suspect, which organisms to suspect, and what droplets, what precautions should be implemented right away without a diagnosis. And of course, you change your transmission based precautions or according to the organism that is isolated. Similarly, respiratory tract infections, pulmonary cavity disease, you suspect TB, severe cough, pertussis. Respiratory infections, again, pulmonary cavity disease, Mycobacterium tuberculosis should be suspected. Airborne precautions are recommended. For severe paroxysmal cough, pertussis is recommended, and droplet precautions are, of course, recommended. Viral infections, respiratory pathogens should be suspected, and droplet and contact are recommended. For risk of multi-drug resistant organism, these are usually infection with resistance or colonized with multi-resistant organisms. So these include like MRSA, VRE, and even Candida auris. Contact precautions are recommended. Skin wound infection, UTI patients, a resistant organism again should be suspected, and contact precautions should be in place. This is just to give you example. This is about 10-15 page table about type and duration of precautions that are needed for particular infections from A to Z. So you can see the type of contact and the duration of precautions that should be in place.